Welcome to DesiMD. I'm here with Dr. Satish Vallabhaneni. He's a psychiatrist and he lives in Boston. Dr. Vallabhaneni did his medical school from Siddhartha Medical College, Vijayawada. He moved to Brooklyn. He did his residency in Lincoln Memorial Hospital, New York. Later, he did his fellowship in geriatric psychiatry from Yale University, which is a prestigious university from Connecticut. Today we are going to talk about the most common condition which is present in our society, that's depression. Welcome, Dr. Vallabhaneni.
Thank you for giving me the opportunity to talk about depression today.
What is depression, Dr. Vallabhaneni?
Depression is a clinical syndrome including several types of condition ranging from subclinical to clinical stages.
What causes depression, Dr. Vallabhaneni?
Biological issues which are mainly related to depression or the genetic and the family issues. So if somebody who has history of depression, those type of patients that can be easily prone for depression even with very little psychosocial issues. But if somebody who doesn't have any family history can also be affected when there are more severe psychosocial issues, financial and housing issues, poor social support. So the various biological psychosocial issues that cause depression ultimately lead to an imbalance in the mind where there is deficiency of various neurochemicals in the mind, and how these neurotransmitters interact with the neurons, finally affecting the communication between the neurons that are mainly involved in the areas that control the emotions.
What are the symptoms of depression?
The other physical symptoms of depression that form the part of depression include sleep issues, where a person has difficulty sleeping, who probably will be getting like maybe 3 to 4 hours or sometimes 5 hours, and then usually wake up early in the morning around 3 o'clock and then have difficulty going back to sleep. Along with sleep, the other symptoms are a lack of energy, where the person feels tired most of the day, or even losing weight, decrease in appetite, feelings of tiredness, feelings of having low energy, and also having issues with concentration. So when a person is able to read well in the past, now is able to read a page or a few pages and can focus on what he is doing. The most important feature is the person's global functioning is affected, which is where a patient usually had a job before and was able to do his regular job, and struggling in terms of working daily, will not have any interest in doing his job, will be probably lagging to complete his assignments, and also sometimes will not have any interest in doing his job. So in a way, globally his functioning is getting deteriorated, that he is no longer able to sustain his job, and may one day may end up losing his job. So basically it's the functioning is the final result that we usually also see in terms of a deteriorating patient with depression.
Doctor, is there any age group affected with depression?
Depression can affect different age groups ranging from teenage years to any elderly person who is like 70 years or 80 or even up to 90 years. So it's not restricted to any particular age group. Anybody starting maybe like from 12, 13 or even 14 years of age to the end of life can be affected by depression. So for example, if you take a teenage student who is struggling in his college or maybe going into his higher education, where he is faced with several stressors in his life that include passing an examination or getting a position in his undergraduate education, can play an important role. How well he is able to cope his stress in life, and if somebody who has pre-existing genetical issues or pre-existing family history are more easily prone to developing depression at an early age. And on the other end of the spectrum, older people who are in their terminal stages of life can also be affected by depression, secondary to mainly to medical issues, which include cancer, diabetes, hypertension, or even other social issues, mainly from little support from their children, or being isolated from their family members, or even people who have to live in a nursing home away from family members can also be affected by depression.
Doctor, is there any other medical conditions that look like depression?
We actually start treating for depression, we have to rule out any medical issues in general that can look like or that can cause depression. One of the most important conditions are any dysfunction with the thyroid gland, which is hypothyroidism mainly, that can cause symptoms of depression. So hypothyroid is one of the biological etiologies that I said earlier that can look like depression. Patients with cancer in the end stages of cancer can also be depressed. Patients with long history of diabetes or hypertension or even high cholesterol can also cause depression at one point or other in their life. The other medical issues that can cause depression or contribute to depression are any electrolyte imbalances or any abnormalities with the blood count, who are anemic, who have low energy, and symptoms of tiredness and weakness can also look like depression. Patients who have multiple risk factors in terms of atherosclerosis, who are prone to have myocardial infarction or who are prone to have cerebrovascular risk factors like stroke, can also be affected by depression because just like the plaques of the atherosclerotic plaques, when that they cause MI in the heart, can also be blocking the important areas in the mind where the emotions are controlled and can finally lead to depression.
When should we consult a doctor for depression?
Satish, that's actually a very good question because people who are depressed may not know that they are actually depressed and get deteriorated in terms of their functioning. So basically, whenever you notice a change in your functioning along with other symptoms, as I said earlier, with disturbance in sleep, with decrease in energy and decrease in interest in your daily routine. If you see like around 5 to 6 factors that I mentioned earlier, try to seek help from a medical doctor or a psychiatrist. And patients who are especially having suicidal thoughts or ideations should seek treatment as soon as possible.
Doctor, what are the available treatment options we have for depression?
Actually, there are different options available right now for depression, which include medications, along with other modalities including psychotherapy or even ECT at times, depending on the severity of symptoms. Medications mainly, which are the group of medications called antidepressants, which have been present in the market since 80s. Now more and more medications have been come out since then. We have more newer medications that act in multiple areas of the brain to help depression. The other modalities, as I mentioned, in terms of psychotherapy include individual psychodynamic psychotherapy, cognitive behavioral therapy, which are the two major forms of psychotherapy that helps with people with depression. The major treatment option that's also available is ECT, which is called electroconvulsive treatment, which is basically a type of shock treatment that's applied by giving electricity to the brain by placing some electrodes on the head. So how it works is a patient is given anesthesia, and when the patient is anesthetized, a brief electric shock treatment is given for a few seconds, and the patient usually regains consciousness after maybe a few minutes. So if the patient gets these treatments like 3 times a week for maybe like up to 6 to 10 treatments, can show a dramatic improvement in depression. ECT is commonly used for patients who have very severe symptoms, who had past response to ECT, are all candidates for ECT.
Can we cure this depression completely?
Actually, we can, depending on when you see the patient. If the depression is diagnosed early, you have to start treatment as early as possible, and where it's actually possible to control the symptoms of depression. The more you delay the diagnosis, the more you delay the treatment, the harder it is for the medications to work. The resistance to medications is very common, especially patients who have more episodes of depression in their life. The chronicity, which means the longer time they are depressed, the harder for the medications to work. So it's better if you treat early once the depression is diagnosed.
Are there any side effects of the medications?
The side effects for the antidepressants, which are mainly can be classified into short-term and long-term. The short-term immediate side effects, which include nausea, stomach upset, or even diarrhea sometimes, are usually limited for a short duration of time, maybe for a few days to up to 1 to 2 weeks. They should go away after a week or so. But otherwise, the long-term side effects can be like weight gain, can also include issues with sexual interest or maybe sexual dysfunction, or even can also affect the other parts of the body, like heart and other systems when there are multiple drug interactions. So you have to keep in mind, the physician has to keep in mind what other medications the patient is taking. The other side effects that's probably that we can talk about are from ECT, which can have some issues with memory at least, but usually the memory problems, they go away after a few treatments. They do not, most of the times they do not last long.
Is there any new research coming up for depression?
There is so much research going on in terms of treatment for depression. Some of the newer research methodologies include with medications, where newer medications have been out in the market that help with depression. The other treatment options include transcranial magnetic stimulation, where stimulation is applied for the brain by giving some magnetic stimulation to the brain, which indirectly affect the emotional controlling centers of the mind.
I heard that the drug abuse like alcohol, marijuana is associated with depression. Is there any connection between these two?
Satish, again, that's a very good thing to discuss, because basing on the current research, it's hard to see what's causing what. It's like the relation between the chicken and an egg. You don't know which came first. Sometimes you see patients who are depressed end up using drugs later to self-medicate their depression, and in long run worsening their depression. But sometimes patients can actually start with drug initially, start with drug abuse initially, who use marijuana, alcohol, heroin, cocaine, and once they have been addicted to these drugs, after a while they actually cause an imbalance in the mind, and then develop depressive symptoms. So you see all sort of patients who use drugs developing depression, and then people with depression and use self-medicating their symptoms with drugs, but in long run they are actually making themselves worse. So it's possible in all variations.
So Dr. Vallabhaneni, is there any take-home message you want to give to our audience?
As I said, depression is actually a clinical condition. When I say depression, I meant by major depression. It's a clinical condition that's well recognized in the medical field, and actually if it's diagnosed and treated early, it's completely curable. There's a lot of social taboo in our country, where people think that depression is part of daily routine and actually delay having treatment from a psychiatrist. So when it's diagnosed and treated early, the depression can be cured completely. So that's my most important take-home point is seek help from a psychiatrist as early as possible if you believe that you think you are depressed, and especially considering other symptoms that I stated earlier. I would appreciate very much for giving me this opportunity to talk about depression and in educating people to learning more about depression.